Thank you.
Okay, thank you very much for joining this meeting, and welcome to you all for this for giving us an opportunity to share our thoughts. First, I would start with the present process of the statistics form and the new process, and then I would go into the overview of the statistic form, how I am maintaining, so that I can give you some ideas on centralized email ID and how it is maintained. Next, we'll look into the forms, actual forms of 2015. Okay, please stop me.
Excellent.
Yeah, please stop me at any point of time. Just switch on your headphone and just stop me whenever you have clarifications. Okay, then I start. See, till 2014, what we used to follow was once we upload this various languages statistics form, we used to inform the regional offices and the country coordination offices to export it and send it to the partners. Till there, the process remains the same. After that, the projects used to fill in the forms and send it back to the regional offices. There is now a small change in 2015. As you already know, we have created a centralized statistics email ID, and we have requested all the partners and the projects to send their statistics to this centralized email ID. And if you require, you can request in your email that a CC copy can be marked to the concerned PO, so that he is also aware of what the partner is sending to the centralized statistics email ID. I'll just show you my how it looks. Hope everyone can see my Outlook box.
Yes, from my
Yeah. Others also, I feel. If you are not able to see, just switch on your microphone and say no, so that I'll wait for some more minutes, some more seconds. Okay. Yeah. See, as you see here, you can see a CBM statistics icon. Like this, there will be an icon for David and Janet, because these two are the people who were given as the statistics contact people. Yeah. Yes,
Sorry,
Edwin.
I cannot see. I'm seeing your inbox.
You're not able to see.
Sorry. Yeah, I'm only seeing your inbox.
So you're not able to see.
No, I'm not seeing it.
Oh, okay. Just let me try once again.
Just to clarify, Venkatesh, it's the inbox you're supposed to see.
No, I'm just
so just to clarify for Edwin.
Okay.
Yeah, that it's the inbox you're supposed to see.
Yeah, this is the icon. I'm just starting with the icon. This is the icon, CBM statistics. This is the icon that will be appearing in your Outlook for Janet and David, because these two people were given as the statistic contact people. Then you can see the inbox, where we have created subfolders for each region, right? So whatever the partners will be sending, will be pulling the emails and putting into the respective folders, what we have subfolders, what we have created for each region, so that you need not search the whole inbox or all the emails. You can just go to your respective folders and you can see into the emails. That is the first step. And what I would do is, I would be creating an overview. Just a second. Oh, this window. Okay. Yeah. Can you see the Excel table?
Yes.
Fine. This is the Excel table which I'll be maintaining. This is containing two worksheets. One is first worksheet is overview, and second worksheet would be the project count. Here, what you can do, you can select to your respective region and even filter it for your country. For example, Burundi. I just okay, so that you know how many projects have to give the statistics for that Excel. For example, 1312, if they are sending statistics, say 25th of December or 20th December 2015. As soon as it comes into the inbox, I would just drag it and put it in the respective folder, and I would update this one. This Excel is just for information and to cross checking which has been arrived and which has been not arrived. And once this is technically checked, technically means if there are no red marks or if I'm okay with it, I would just upload this one as the draft figures. Okay, and only when you endorse the data saying that it is okay, then only I'll be putting an S here. Okay, till then it will not be there. And what I would be doing is, in this first sheet, I would just refresh it so that you know that out of, for example, 90 projects, one has been received, one is technically checked okay, and 19 out of this 91 is received and 99 are pending. If you go to the second box, you can just say, see what all the things that are pending. This is just an, oh, you can't see the Excel sheet. Oh my god. Okay. 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 Now you are able to see the Excel. Okay, fine. Okay. This is the Excel. Just for information, I'm telling this will be maintained by my end, which will be having two worksheets. One is first worksheet is overview, and the second worksheet will be the project count. Here, what you can do, you can select your region for the breakup. How many have received? For example, you can even country also. For example, you can select Ethiopia, so that it gives only the list of projects only in Ethiopia. What I do, for example, 311, if they have sent the statistics, I would just update the date of statistics as when it is received. Okay, and if it is checked, sorry, this is received at IO, I'll just update the date when it has been received, so that if it is technically check, I would be doing only the technical part checking. Means if there are no red screens or red cells, or if the logic of the things is okay, then I would just upload it. Why I'm uploading it? Because the management and the MAs require at least the trend figures by January, and that is the reason why we have preponed the date to 15th January. What I request is as soon as you send it to the partners, what they can do, they can fill the statistics data, the statistics form, and they can send it, and they have all the chances to revise the data after discussing with you, or if your PO wants to change the data, they can still do it till 30th January 2016. But if they don't want to send the data now and do a revision in replacing in January, they can send it once for all before 15th January, and the regional officers have the chance to edit it till 30th January. Fine. what I do in the first worksheet, I would just upload it so that you know out of 90, 2 are received, 1 is technically checked, and 88 are pending. So that this Excel I would be maintaining at my end, and I'll be sharing with you every once in 2 days or once in 3 days, so that you are aware how many are received or how many are not received, so that it's easy for you to follow up. Any questions?
Venkatesh?
Yes, David.
Hello?
Yes, I can hear you.
Just a clarification.
Yeah.
So basically, you expect the regional office to clear, I mean, the statistics by the 30th of January.
Yeah, because it is the request, because the management of CBM as well as the MAs wants the data before 30th, and before February we have to give a report. And also, as you already know, for only 2015 this will be yearly, and the same form will be used in 2016 as a quarterly statistic form. And another thing is, before we start the quarterly rollout in 2016, this with the same statistic form, then we have to close the yearly statistics of 2015. And in the previous year till 2014, what we used to do was, the statistics used to come till March, April also, and we were producing our report only by the end of April, where the 4 months of the year has already gone. And if there is any problem, we were not able to. It was not a proactive, but it was a reactive. What we want to make it as, so that's also a reason. And the MAs at least require the trend figures at least in January to know how we are going. That's why we are requesting. So if the partners can send the before, for example, if the partners are not doing much in the, say, after 15th of December, they can already fill in the statistics and they can send it, and they have all the chances to revise it if they want to till 15th January. And the POs at the regional office have still chance to revise the data in discussion with the partners till 30th January. Yeah. Yes, Janet.
Okay, I'm not sure if this is now the time for. Sorry.
Yes, please.
No, it's okay.
Okay, I don't know if now is the time for all the questions, or you want to wait at the end, or
no. Relating to this, if you have any questions, you can just ask me here. Relating to this process.
Okay, so yes, the process is pretty clear and the templates are pretty clear. Thank you for that.
Okay.
My first question inherent to the timeline is, of course, with regards to the compliance of the partners.
Mm-hmm.
And what does this process entail in case the partner is not compliant with the date of the 15th or even, the 30th of January? And the second question, but I don't know if this is the right time or we have to wait for later. How do we align the quarterly statistic, forms, etc., with the current PPR system?
Yeah, good questions. Both two are valid. See, the first question is how to cope up with the timeline. This was a real challenge for us, and it's also a real challenge for all the regional office and the country coordination officers. But that is the deadline given to us also from the management and the MAs, because they want at least the trend figures. That's why I'm telling, if the partners at least share, for example, by next week, if you are sending, by Monday, you are sending the statistics form to all the partners. They can even send it in November, whatever they have done till October. That's no problem. They can still have the chance. At least we have the figures, first trend figures. That's what I mean to say. So until November, if they have done, or something until December starting, if they have done it, they can just fill in the numbers and they can send it, so that they have the chances to revise it before 15th, so that at least we have a trend, so how we are going, so that we can say, oh, this is what the trend is for 2015. Is it okay with the first answer? Are you satisfied? Yeah.
Venkatesh, can I add something?
Yes, please.
Okay.
Okay. Mine is just one thing. Obviously, contractually, we have had a different date. Now we are bringing the date forward. I'm wondering whether there is official communication that comes from international office on this, because they're the only ones who also sign the contract from their end. So I don't know how we can demand the partners to give us statistics early, and we don't have official communication, from the international office on the same, because they're the ones who also sign the contract, and the current contracts are giving a different date for submission.
Okay. This is really because I was not aware of this one. What I could do is you can just send me an email to Rolf, Karen, and CC copy me in on this, so that we'll discuss and get back to you as soon as possible. Okay? Because I was not aware of these dates given already to the partners. Is it fine, Janet?
Yes.
Okay. And the second question relating to David, how we are aligning, because if you can see this, we'll just go to the statistic form next. As I think you have already seen the statistic form in English. It is only the must-haves, if you can see, because earlier if you had 9 worksheets with 500 codes, different codes, but now it is just one sheet with only 128 or 130. It is just 1/4 of it, which is prepared based on the input given by MAs, advisors, and the management on their must-haves. This is the first step what we are taking to reduce the statistics to an extent that it is possible, and to satisfy the other stakeholders also, so that they are able to present the CBM data in various international platforms. That is the first step. And the next year fully we'll be working to align these statistics into the PPR, so that at least by 2017 we achieve that there is no statistics anymore, so that it is integrated into the PPR. That is our aim. So that next year only it will be quarterly, which will be running parallelly with PPR, and for 2017 we hope that it will be integrated into the PPR, and that's why we have taken only the only the must-haves, and we are trying to do it next year. That is the relating to the PPR alignment with the statistics. Yeah. Yes, David.
Okay, on my side, we have to see how to roll it out. Thanks for the explanation. I think it will present more challenges than what we are now considering, but because we are now missing the feedback from the partners, right? So we will have to see. I don't know how other regions are reacting to this.
The feedback is, for example, if they are sending the filled-in statistic form to the centralized statistics email ID, you can always request a CC copy to the concerned program officer, so that in one shot it appears both in the centralized statistics email ID and it will be with the program officer. So the program officer can check on the validation of the data, and I will be checking on the technical part of the form, so that once in one shot both the things can be clarified, and the process will be faster, and we get at least a trend figure.
No, okay, I fully understand from your side, working on statistics, how this is going to improve greatly the system, and I understand it. On my side, and probably also connected to what Janet was mentioning before, in terms of contracts and timelines and obligations, and especially repercussion in case of lack of compliance. Because I did understand, I've only seen, end of last year, the statistic process, because it's just 1 year and a half I'm with CBN.
Okay.
And at one, yes, so it's not, I'm not a CBN born and bred creature, but anyway, I'm trying to understand. I saw that when a partner does not comply, and of course we had a few issues within this region with the submission of statistics, a red flag or proviso might even click in. Now we are, and this was the yearly statistics. So now we are going into quarterly, you know,
that is from next year, David. It is from 2016.
No, I understand. But next year is behind the corner. We are already in December, so we are talking about, you know, less than 40 days from today. And what have you discussed also with other regions in terms of, you know, let's say during the rollout phase, the first half of next year, checking the compliance of the partners. If they're not compliant, how have you discussed also with other regions? Do we have a sort of a buffer period? Are we also contemplating additional trainings that we could do also at regional level?
David, I think your voice is very low. Hello? Your voice is very low.
Sorry, Venkatesh. I'm saying, how are you coordinating also with other regions the rollout period for the quarterly submission of the statistics? Are you contemplating trainings? Are you considering buffer periods for adjusting the compliance issue? How is it going to be? Or it's simply, you know, starting from first quarter, that's the story and that's what we have to do?
No. Relating to quarterly statistics, we'll be sending you a separate a communication itself. If you require a separate go-to meeting to clarify your issues and anything related to quarterly statistics, it would be in a separate communication as of now. And we have to work out on the deadlines also, and we have to adjust this form what you have as of now for 2015 yearly. This we have to adjust it to the quarterly. So we have to make bit alterations to ensure that it takes the quarterly figures into the Navision as well as our target new software to analyze this data. So that will be a separate communication. Yes, Janet.
Okay, Venkatesh. Yeah, just to put some consideration, because we didn't have a pilot for this rollout of the quarterly reporting, and obviously, if you're talking about the statistics forms also changing, I think it would be important to just reiterate what David said, that you have a grace period. Like, for example, put on proviso, for example, partners who haven't submitted, let's say, statistics forms 2 quarters in a row, but not just immediately 1 quarter.
Yeah.
Because with different sorts of partners, capacity is an issue.
Definitely. Definitely, because I think this point was also raised when we had a meeting with the regional directors. They said that if the partner is not complying for the first quarter, they should not go under proviso, because we have to train them and it will take some time. So what we had agreed was, for the first quarter, if the partner is a little bit late also, we can just it's fine. But for the second quarter, at least before the second quarter, you should be able to cope up, and they should be able to give us the figures on time.
Okay.
Yeah, that will be, everything will be in a separate email for you, and I think we'll also discuss we'll be also sending an email to give your feedback on the quarterly statistics. What is your something like if this is okay with you, or if there is any changes required, or what is your additional questions or something like that, so that the quarterly statistics is a separate process. But the form as such, if you, I'll just show you the form. Just wait a moment. Yeah, can you just see the form? CVM Stats 2015. Okay. So this is in this form you don't have a provision for a quarterly. So what we would be doing, we have already made the provision, but we have hidden this one so that the people will not use. Yeah, this is a quarter, if you can see, and we have the provisions for it where they can select for, which will be pre-filled when we are sending itself. That's what our plan is. And also this is for 2016, we still need to work out on few wordings also to suit the quarterly statistics. So just to let you know that we are already in the process, so it will be done as soon as possible, and we'll let you know on the quarterly statistics as soon as possible, and we'll give you I will send you an email so that you can give your replies saying that what is the possible and what is not possible, what would be your additional requests, so that we can discuss with the management and see. We will get back to you on that. Yes, David.
Venkatesh.
Yeah.
Venkatesh, yes. Can you hear me?
Yes, yes.
Okay. One further question. I went through the templates and I saw that you have substantially reduced the number of questions. That is very appreciated.
Thank
However,
you.
I understand that there are two different templates. One, the general statistics form, and one for entities.
Mm-hmm.
Am I correct?
Yeah.
Yes. Is this going to be utilized, I mean, this double template system also for the quarterly reporting? That is because
no, entity will be yearly.
Partners. Okay, so entities will be yearly, and the general statistics form will be quarterly.
Yeah.
Okay, because of course we do have partners that work on eye health that also have entities work, especially within the area of trachoma.
Yeah. See,
and we are quite concerned of these.
Yeah, as I had informed you,
yeah.
For 2015 we require the entity statistics only from 13 projects, and I think 6 to 7 projects are from AFE. From this 13 projects only we require, and we have made provisions. When you export the forms, you get the entity form, but entity French and Portuguese are not yet available. Yes, we are still working on it.
Okay, so for 2016, we have the quarterly submission of the CBM statistic form, the one that you're showing us now.
Yeah.
And by the 15th January of 2017, we will also have to receive the yearly statistic form for entities.
Yes, perfect.
For the year, for 2015.
For 16.
Okay. For 2016. Yeah, and yeah, because I can see, I don't know how also Janet feels and the other colleagues, they feel about it, but I believe that although this form is not completely different from the previous one, but yet there are some differences for which we will have to organize trainings at country level, because otherwise we will definitely encounter
because that was the reason, David. We took I think 90% of this form is just what you see. I'll just show you the comparisons also when I'm going through the form, how it relates, so that it is easy for you to understand also. And there are only very few parts where we have included, and we have given the chance that if those things are not available, then if it is an addition in this form and the partner has not collected those details, then he can just need not fill in. That's what we can do. But at least he has an information that from 2016 these are the details required and those needs to be filled in. Okay, then I would start with the statistics form. This is an unprotected form which I'm showing, but when you download the form, the sheet will be protected, and the partners can see only partners and the projects can fill in only the yellow cells, and no other cells they can edit. But I from my previous experience, I understand that few partners are very innovative and they just copy paste or do all the innovations and change the structure itself. So I request you to please inform them that not to change the structure and use only this form. That is the first request. And the main thing is in the yellow cells, wherever you click on the yellow cells, a message pops up as a background message to just highlight what to fill in that cell. If you click on any yellow cell, a message pops up and you can drag and keep it wherever it is not disturbing you. That's the first advancement what we have made in this one. So that earlier, when you wanted to fill in some code or something like that, you had to go back to the manual, look into it and fill in. Now what we have made, it is just acts as a small manual to fill each and every cell of the yellow cell of this statistics form. And starting with the sub project number and sub project name, I think you are already aware of it, but I would like to just highlight information that the sub project number, for example, when you download a form, for example, when you have downloaded the form for this project number 2245 2015, it would download like this with a pre-filled project number. And for example, if this project number 2245 is working in two places and they want to report the statistics separately for these two places, they can still do it. They can just select 01 and put a place number and file, save as, just save it as 01, save, and they can fill in the form. And the second place, what they can do, they can just select 02 and put B and save it. And what they can do is they can send both the forms. They need not sit and consolidate the numbers, or the regional offices need not sit and consolidate numbers. They can send both the forms and both the forms will be uploaded in NAV. The advantage is in future, even from the quarterly, if you are using 02 for place B, that is a consistency that you have to maintain, that 02 is given to B only and not for A in the next quarter. So the advantage is you can monitor just B if you want, or whole projects if you want. You can get the figures for whole projects or even for a single unit. That is the main advantage of using this sub project number. I think you are already using it. I just wanted to highlight this one for if other persons, if they want to inform their partners, if they are manually consolidating, it is not required. The system can consolidate this one. Okay. Okay. Fine. Then I would go into the columns. You see these columns D, E, F, G, H, I. These were the same columns what we had in the earlier forms. These are the new columns that has been added, and you will see what needs to be reported under each column when you come down. The major advantage is the Q column, where the partner can fill in any comments if he requires. For example, for this statistic code ST001, they want to put some comments. It may be anything if they want to. What is the advantage is the Navision, when we import this into the Navision, the comments gets also imported into the Navision, so that for the project it is there in the Navision, for the project officer also it is there in the Navision, and for the country and the regional office, what we can do, we can generate a report how many projects have given comments for this code. We can generate a separate report and give it to you if you require on any of the codes. So the major advantage, earlier they used to send an email or an attaching email writing their comments, which was not captured in the Navision. But now whatever the comments they want to give, they can give it in the column Q, but they should ensure that they are not merging the cells like this and giving the comments. One row should be used for one code, the respective code, respective column. Otherwise the nav, it will not get imported into nav and we may lose the data. That is the importance of this comments column. And the other advantage also, if they already know, if they, for example, last year they have performed 1000 cataract operations, this year they have performed 5000 cataract operations, they can already give a comment saying why there is an increase. For example, in the other way around, last year they have done 5000 operations and now this year they have done only 1000 or 500 operations or 0 operations. They can already just say that last year this was a thing and this year that's why you can see a deviation from the previous, if they already know. So that this will reduce the communication between the international office and regional office and the partners. That there is also an helpful function of this, using this comments column. Fine. Okay. Okay, then I would go by section here. Okay, the first section is the focus and second section would be the type of impairment. First section would be focus, where it will start from row number 15 to 23. Here, vision, you see separate rows: vision, hearing, physical, education, CBR, CMH, livelihood and other services. These are nothing but these two sections, this focus section and the impairment section. These two sections acts as a bridge to your previous data. That's what we have put it here. CBM had separate statistics form for vision. I'll just show you the 2014 form. Where you had general, vision, NTD, hearing, various worksheets. But now this various worksheets have been reduced to, means the naming has been reduced to each line. This is what. So in the previous years, this will act as a bridge for the previous year's data. And if the partner is doing vision, we can just go here and just select yes. And you can also read in the background cell. I'll just read out the background cell. Select yes from the scroll down menu based on the main focus of your project or program. Then you may fill any section below if your project activities fits the statistical questions. That's what means these two sections acts as a bridge to the previous data, and below that any project can fill in any line. Below 43, any project can fill in any line if the statistical questions are fitting their activity. This is the focus. First section is the focus. Second section would be the impairment or disability. You see various types of impairment or disability. It was nothing but in the previous year form in 2014. In the CBR CMH form, you had clients category: visually impaired, physically impaired, all these categories you had. And education form, you had the same: visual, hearing impaired. So what we have done in 2015, we have clubbed these two and we have put it in one row, so that column E, F, G, H needs to be filled in by CBR CMH livelihood projects, and K, L, M, N will be filled in by education projects. And as I told you, they can give the comments if they want to, and this also will be imported to nav. This is relating to the first two sections of this form. Any questions relating to these two sections? Okay, David. Yeah, Edwin, you have any question?
Not really.
Okay, fine. Then Next, what we have done is we have segregated the data for as all the data below this 43 row into 3 sections. One is, as you see here in the green cell, health, education and livelihood, and inclusion and empowerment. First, we start with health section. It is per work area. Okay, health section. The first section would be here. Here it would be medical services. In this section, you'll be counting number of persons and thereof persons with disabilities. This thereof persons with disabilities, this was not asked for the medical project till now. We were asking only the number of persons, but this is an addition what we are requesting for 2015, and what we understand from the medical projects from the regions, other regions, is they are already collecting. But what we understood from the previous years was they were already collecting out of this. If there are say 100 men, they were already having persons, they were already collecting. It may be an inclusive setting. They were already collecting how many are persons with disabilities. So we thought, and also as per the new UN something regulation or some stand, what I do not know much about it, that we need to collect on the data on the persons with disabilities. As a person, as an organization working for disabilities, we thought, okay, let us give a first step that if they have this data, let them fill in. And on the comment columns, we have given that if available, enter disaggregated data on disability. Please comment if you do not distinguish and count persons with disabilities. If you are not distinguishing, then just give a comment if you want to, saying that we are not distinguishing as per the disabilities, we are just counting the number of persons. But this will act as a education tool also, that the partners from next year, they should be able to collect the data for persons with disability also. In the whole section, medical section, you will be counting number of persons, and if there are 100 persons here, it may be, as you see, I'll just read out the box here. The first line, 46th line would be, if you go to the men, it will read out, men screened, examined, treated once or more during their at your project program. Each person to be counted only once per each service. That is vision service. It can be hearing once. So the per service here also we have given each person to be counted only once per type of service. And you have a thereof code throughout the form. I'll just show you how it works. For example, if there are totally 100 men screened or examined or treated or whatever intervention made or anything, but counting person once, if there are 100, how many of these 100 were given vitamin A? Maybe 25. Okay, and out of this 100, how many are coming from screening? This 100, say maybe 50 persons screened. This will not give any red cell if you see. But for example, instead of 25, if the partner mistakenly types another 0, 250, then you can see a red cell on the top saying that there is some problem with this number, please check it. So you can check it, the both rows, and he can correct it. When he is entering itself, he knows where is the mistake. And at the thereof persons with disability also, we have made the conditional formatting for the totals. For example, here instead of putting 15, if we puts an example another 150, then it says this number needs to be corrected. So you can see that row. What is the problem? If you see this number is lesser than this number, then you have to correct the numbers accordingly. And this logic applies everywhere. Throughout the form, we have made the conditional formatting just to ensure that the partners, when filling in only, it pops up as a red cell so that they can correct it accordingly. And for regional officers, it is easy to see, oh, if there are notes red cells, then they are okay. Then you can check the validity of the data. And if you see, if you click on a yellow cell, it pops up a message that you need not again go to back to the what was there and what needs to be filled. You can just see on the cell that, okay, here in this cell, women treated with vitamin A, or each person to be counted only once, irrespective of the number of. So it already gives a message what to count and if the partner has counted clearly. This is the first section related to medical services and the thereof codes. Any questions relating to these two medical services and thereof codes? Okay, thank you. Next section would be operations and surgeries. Here you are counting number of surgical procedures. For example, if the partner has done 1000 cataract operations, just put how many are for men, how many women, how many boys, and how many girls. That's all. Don't worry about the number of persons. It is number of operations. The whole section of operations. Till row number 81. And if they want to give any comment, for example, other operations related to eye health, if they are putting any numbers and they want to put a comment something like, okay, these operations were related to something like this, or they can give any additional comments if they require. Okay. Fine. Next section would be, this is training health. Here you would be parting in this section, you will be counting number of participants. This is from 84 to 109. Earlier, in the earlier form, in 2014, you had less than 1 month, 1 to 6 months, more than 6 months, professional degree, so that different columns you had. I'll just show you this other form also, 2014. In 2014, you had these columns: professional degree, 1 month, 5 months, more than 6 months. So all these are not required now, and in the earlier form also you are counting the number of participants. Please indicate the number of participants who completed the training. So the same logic is applied here also in 2015. Here also you will be counting number of participants, and you will be just filling how many men, women, boys and girls. If you can see, for the doctors, nurses and therapists, there is a breakup required, but for technicians there is no breakup required, because earlier we had just given 4 rows, one for doctors, nurses, therapists and technicians, but the MAs, some MAs, they wanted the breakup because they were reporting on some of their, and the advisors also, they were reporting on some of these figures separately. So for these things you see a breakup, and for technicians and others you don't see a breakup required. In this section, what you have to remember is, for example, if there are 2 eye specialists trained, or the participants, out of these 2 you have a line here in row number 109. It says thereof total number of participants graduating from professional or professional trainings receiving certification. This means out of these 2, how many are graduating with the technical trainings long term, more than, which is 3 months, with certification. For example, a doctor sponsored for a medical course. This was a special request by one of the MA, that they wanted to know how many doctors or how many persons they are or sponsoring for technical courses or something like that. So this was added. This is out of this 2, if 1 person is given, then it's okay. If you say even 2, it's fine, because it's 2 here. But if you say 3, then you see a red cell on the top, which means that this 3 should be included in this number also. Thereof code. Okay. Next section would be assistive devices. Here you are counting number of assistive devices. If you see the assistive device section, in the earlier form you had the assistive devices section in each form: vision form, hearing form, CVR form, and education form. And if you observe, low vision devices were there in the vision form, a CVR form, as well as education form earlier. But now we have reduced everything and we have just put one section for all assistive devices. Don't worry, if the project has dispensed 1000 low vision devices, just put how many for men, how many for women, how many for boys, and how many for girls. Don't worry whether it is a CVR project, whether it's an education project. No, as I told you in the beginning, below they need to report as per the work area. So this low vision devices is applying, they have dispensed, so report it here. Next would be therapy and rehabilitation. Here in this section you will be counting number of interventions. Till 2014, here in this therapy and rehabilitation sections, you were counting the persons, but now we require the interventions, because it was a request by many other regional officers also, that it was easier for the projects to count the number of interventions than persons. For example, if the project is conducting, say 100 physiotherapy sessions, they can just put it how many for men, how many for women, how many boys, and how many girls in a year, but not how many not counting the persons. That would be difficult. So that's why, anyway, we are getting the number of persons on the top, which they will be reporting here. Sorry, in the health section, here they will be counting the number of persons with different categories. So in this therapy and rehabilitation section, it would be good if the thought of asking the number of interventions, which will ease the project also to report. And also we can, in this section, we'll note the workload of the project also, so that even if there are 10 people, if they are conducting 1000 therapy sessions, we know earlier they were reporting 10, but now it is 1000, so that we know the workload of the project and the number of persons on the top. And the next section would be referral and facilitation. Here you would be counting number of persons. This referral and facilitation, there are only two lines. The referral is just referring a person to get a intervention or something, an operation done somewhere. They are just the projects are just directing the persons. But in the facilitation, they are not just directing. They will be with the person, arrange a transportation, make the negotiate with the doctor for a surgery, and they get the surgery done, all these things. But actually the surgery will not be done by the project. For example, a CBR project, they will do all the background work except for the surgery, cataract surgery, but they were not able to report. Now they can just, whatever the background work if they are doing, they can just put it how many men, how many women, how many boys, and how many girls they were facilitating. And if they are just referring to some hospital, to directing them to go there, they can put their numbers in the referral row. And this is the end of health section. So if there are any questions related to health section. Yes, David.
Venkatesh, just a question starting from the last, the referral and facilitation. Yeah. Referral also implies medical facility towards other medical facilities.
No, I didn't get you really. Can you just give me an example?
An example of a secondary health facility that is referring a case for a complicated surgery to a tertiary level health facility.
Definitely. That would be a referral.
Okay. And what you say, when we sponsor actually transport, whatever, etc., through a program, that will become facilitation.
Yeah. I'll just read out the wordings what we have given for referral and facilitation. For referral, number of persons who were advised or directed to make use of an external service, but no personal assistance given. That is referral. Facilitation would be persons receiving personal assistance to access the above medical services and or rehabilitation services. The project staff may accompany and assist the person in every stage until he or she has received the services. Fine, clear?
Yeah, it's clear.
Okay, thank you. Any other questions? Okay, then I go to the next section, which is education and livelihood. Education and livelihood, in the first line, in how many are in integrated and inclusive settings and how many are in special classes. So here you will be reporting only persons with disabilities, right? Out of this total education, how many are in preschool, how many are in primary, how many are in secondary, and how many are in non-formal. Next line would be out of this secondary. For example, there are 2 who are in secondary. Out of these 2, how many are being graduated? Maybe 1. And next 2 lines would be number of persons with disabilities who receive school-based support and number of persons with disabilities who receive home-based academic support. If you see, these are the same questions what we were asking previously. These 2 in CBR form and all these were in education form. So we are maintaining the same thing here also. Okay. Then next section would be training teachers related to, this is on inclusive education or specialist training. On the top you had seen the training related to medical section or health section, and here it is related to education. You see the number of participants and there are participants with disabilities. The same logic, if there are 10 men totally, in that out of 10 how many are persons with disabilities. And next would be the livelihood. In this section you will be counting number of persons and there are persons with disabilities, and you see same structures, number of persons and there are persons with disabilities and there are codes. And I would just like to this was rewording given by the livelihood advisors. If you can just go to the yellow cell, you can just see what is the description given for, just for example, 4700 code, number of persons receiving vocational or professional training long term. This is for men receiving long term vocational or professional training exceeding 3 months at least, likely with graduation or certification. Training in disability specific workshop that is sheltered and or not in mainstreaming. This is in the first, say there may be 10 for example, and out of this 10 trained in inclusive and mainstream settings. This is men receiving vocational or professional training in inclusive mainstream setting. Example, a vocational training center for anybody not disability specific if they are getting trained. This question refers to the long term, and the same way as the second next line would be relating to some business skills for setting up their own shop or something like that. And out of them, how many are trained in inclusive and mainstream settings? Earlier we had only for the persons with disabilities, but the livelihood advisors advised that there are many inclusive settings where the, for example, the parent of a, for example, a parent or a person taking care of a disabled person also will be trained, so that you can put the numbers here and there are persons with disability, so that we know. And what we understood was this is what actually happens in the field from the livelihood advisors, so that it will be easy for the partners who will be filling in to report it easily. So this is what education. Yeah, yes please.
Yeah, just a question.
Yeah.
Most of our programs, they do support persons with disabilities.
Mm-hmm.
So that's our target group anyway.
Mm-hmm.
And I was now wondering, because we might find the first part of the template with no data, and we only fill the part where refer to person with disability, or in any case it will correspond. Also misleading in terms of the total people who have been trained, out of which how many persons with disability, but that doesn't mean that all the people that were trained were actually supported by CBN.
Yeah, definitely. The concept for reporting the statistic form, that's a very really good question, David. I just wanted to inform you in the end, but you raised the point. I would just clarify here itself. For reporting the statistics form, the logic is if the activities, what we have signed with the project is falling within the framework of the signature and the contract what we have signed with the partner, then they can surely report it as a status in our statistic form, even though if we are not supporting it, because it acts as a project, it whole project as a whole project, and we are not considering whether it is financed by CBM or not. If we are signing with a project for those all these activities, and if it is a result of those activities, they can really go ahead and report it here. Okay, any other questions, so that we go to the next section? Okay, then I would go to the next section, and the last section in this form is the inclusion and empowerment. In this we start with the first section as staff. Here we'll call number of, first we count number of staff and thereof staff with disabilities, as like in the same previous form, but very less, only 3 lines. The first line would be staff employed at the project or program regardless of CBM support, fully, partially, not financed by CBM also. For example, if there are 10 men working for the project and 5 women working for the project, and out of these 10 men, how many are in the management? Maybe 1 person in the management. Next, out of these 10 men, how many are fully or partially financed by CBM? Maybe 2. This is the logic, so that we get the overall staff strength and how many are supported partially or fully, and out of this we know how many are in the management. In this we also know, for example, if there is 1 person in the 10 persons in men, and if there are 5 persons with disability, so we also know that what is the ratio of staff strength with disability at the project. This was the logic why we put it. And the next sections would be child safeguarding. Here it would be. Yes, please.
I have a question.
Yes.
Yes, I have a question.
Yes, please.
What in case our yes, please. Now, what in case our programs are with the contribution towards a staff and not the full the payment of the full salary, which is actually a direction in here. So we have programs whereby we contribute towards the salary of certain position, technical or managerial. And how do we factor that in? Because maybe we pay the 25% or the 10% or the 75%, whatever it is, but how do we consider?
What I would suggest is it may be related, for example, there will be, even if you contribute, there will be some percentage, right? They will be having a head count. For example, there may be 10 overall staff and you are saying that only 20% of it. For example, you can say here, if you are 10 staff and you are if you are financing 20% of that staff salary, then you can just put it as 2, and you can just give a comment here in the comment box saying that out of we have, out of these positions we have given only as per the percentage of the thing. For example, if you are very clear, say that you have 5 doctors working for the project, and for the 5 doctors, all the 5 doctors, you are paying only 20% of their salary, then you can just fully count as 5, because all the 5 are partially supported by CBM. And if you are not clear how many people you are partially supporting, then only you can make an average. Got my point? Or
okay,
yeah, see, for again I repeat, for example, if there are five nurses, for example, if they are working for the project, and for all the 5 nurses, if the CBM is supporting only 25% of their salaries, you can count it as 5, because it is even partially supported by CBM also is counted here. But
so regardless the percentage, we look at the partially supported as
yeah,
the bottom line.
yeah,
Okay.
that would make the life of the
Okay, thank
projects
you.
also easier.
Okay, okay, thank you.
Okay, then next section would be child safeguarding and child protection. Here you will be counting number of participants and thereof participants with disabilities. The same logic for empowerment. Just here in the empowerment end, you will be counting number of members and thereof number of members with disabilities in the child group, parent group, and self-help and DPOs. And here I would like to inform you that in this line, row number 197, if you before clicking yes, selecting yes, would like to suggest that only select yes from the scroll down menu if your project engages in constant and structured activities and efforts, unless leave it blank. If it means that if the project is continuously working on the advocacy activities to influence local or national policies on disabilities, then only it has to select yes in this row. Otherwise just leave it as blank if it's just only one activity or one time activity or not continuously working on this advocacy activities.
Betakesh.
Yeah.
Sorry, another question.
Yes, please.
I might have a program in which I have a in which I have a budget allocation for advocacy activity, which will focus on one event per year, but maybe it's a relevant advocacy activity. So I don't understand exactly the meaning of constant, because I might not have
if your project itself is for advocacy, David, if the project itself for advocacy, you can clearly say it is an S, and you can give a comment saying that yearly once the activities have been formed, so that we are clear why you are putting S here, why you are selecting S. We already know in the comments.
Okay, because the constant bit is what makes me uncomfortable. I might have a partner that is doing advocacy activity, but within a certain period during the course of the year, which doesn't make it constant, but that activity itself is very relevant. And
yeah. If it is very relevant,
it is a structured activity, but it's not constant.
Okay, but it is year on year, or they are doing, right?
Yeah, I'm just giving you an example.
Yeah.
We have a few situations like that.
Okay. No, what we select.
So in that case, I would click yes.
Yes. Yeah, you
click
can
yes,
just,
and then we put the specification in the comment.
Yeah, just give a comment saying that okay, only for first quarter or only in the second quarter the partner has worked on something like this, so that we know that why you are selecting yes in this for this row.
Okay. Okay then.
Fine. Okay. Any questions related to this form? That's all from my end related to this form. Okay. If there are no other questions, then I would just go to the entity form. Hope now you can see the entity form. Yeah. Okay. If you see, we have structured the entity form in the same way where there is structure. We have given the comments, we have given the same columns, same rows, but only the questions will be different for entity, and it is only related to the selected 13 projects what you have to collect. The first line would be number of persons who undergo trichiasis surgeries, and the next section would be how many surgeries has been done for these persons. For example, there are 10 men who are undergoing trichiasis surgeries, and for 10 men there may be 15 surgeries done. So this is the logic, because you see the same persons count and surgery count in the other form also, because for this TT surgeries there was a special request by the NTD advisors where they have to report both on the persons as well as the surgeries. So it is included in the other form also and here also. Here only the NTD 13 selected NTD projects will be reporting their persons as well as surgeries count here, and all others who are doing the this TT surgeries will be reporting in the other form, because they will not be getting the NTD form. Okay, then next section would be, next line would be, as it is an MDA is a public health approach. The first line will be how many number of persons and how many number of persons with disabilities. If you just read this, I'll just read out. You'll come to know. Okay, just give me a moment. Okay, number of persons reached or registered for MDA treatment across all entities referring to 1 to 5 in the reporting area. In the reporting area where the project is working, a person to be counted once regardless whether treated for one or more entities. It is nothing like if a project is working in a district, for example, how many persons in that district were reached by this project, men, women, boys, girls, and out of this how many were persons with disabilities. Next lines would be number of persons treated with MDA. That is here a person, the persons treated for trachoma, persons treated for onco, and persons treated for LF, STH and SCH. And there are chances that a person can be counted in trachoma as well as LF. That's fine. You are counting a person here for trachoma as well as LF. That's fine, because on the top we are getting the total number. Say for example, I don't know, if there are 100 men in the district, what we are raising, and in 100 men 20 are disabilities, and for this 100 men there might be, say, various lines. There may be given, okay, 60. I'm just giving a rough figure because I don't know much about entities. So the same, the person 60s who have received, they may also receive the LF, but and additionally they might have received the other persons, say 80. Fine. So here in this first section you count only the number of persons, and here the persons treated for each individual MDA. That's what the logic is. Next, it would be health promotion education. Here.
Venkatesh.
Yes, please.
Hello, Venkatesh.
Yeah.
Yeah. Could you please scroll up to the previous section?
Yes. Just a moment. Yeah.
No problem. Okay. When we have the trachoma, I mean, under the thing that I see as an issue is that, especially for trachoma, the surgical intervention and the medical intervention, I mean, in terms of antibiotics. So could you please go up again?
Yeah. Till
on
the beginning?
On the first, before
okay.
MDA, please.
Fine.
Yeah. Okay. Okay. So this is specific for the TT intervention.
Yeah.
While the trachoma and the MDA is for the antibiotic treatment.
Yeah.
Treated with. Okay. There are some challenges discussed with Martin Coleman. And I'm sure Coleman is very happy that you have divided number of person and number of surgeries.
No, for your information, we have discussed this thoroughly with Martin Coleman as well as Babar Qureshi.
I know.
And formulated this form.
I know. One time I received a call at 8 o'clock in the evening from Coleman about this template. So, okay. The point is, with regards to how partners might define the person with disability. If you have a trachoma at an advanced stage, which is of course due for surgery,
Okay.
that might also count as a person with disability. Have you discussed this with the advisors? Is that acceptable? Because I can see that coming.
Okay. Can you just send me this question as an email so that I'll send it to Martin and Baba also, so that we can get a response from them?
If you like, if you like, I can also write to them, copy to you.
Yes, please. Please go ahead.
Yeah. Okay.
Yeah.
Okay.
So that we also are aware of
okay, I will do that.
what. And also, as I said, if there are something like after discussing and while going or while filling the form, if you have any such dilemmas in filling, you can just fill in the numbers and give your comments here, so that we are aware that for how many of these, for example 60 or about 30 people, 30 men are, and out of these 30, as you said, some 10 cases maybe with something seriously, so that's why we have put it as like that.
Stage, yes.
Yeah, so that we are aware that okay, out of this 30 there are 10 which has been counted as person with disability because of this reason.
Okay, thank you.
Okay,
so I will send this email copy
yes,
to you, and eventually they will help us. Okay, excellent. Thank you.
Okay, and next section would be health and promotion education. Here you are counting the number of participants. Next would be training and retaining of community and health workers. Here are number of persons.
Wait, Bantakesh, sorry to jumping in. Could you please scroll up again on the promotion?
Yeah.
Okay, what type of activities does this entail? Is it because sometimes it's very difficult to count this, and some health promotion education might also happen via radio, with radio programs.
Because we have put it here.
Or there are community. So, what is there specifics on?
Yeah, because
on this?
because we have said here number of participants for community educated annually or on NTD related health and wash, including trachoma and FNE.
Okay, I see a challenge there, because we do have some programs that do carry out for health promotion on the especially on the wash and behavioral components.
Yeah.
And some of these programs are via radio, for which is absolutely impossible even to provide, an informed projection on the number of people that have been reached. So how do
it is number of participants. If they are, for example, if they are conducting a training, they would have the participants list, right?
Yeah, for the training, yes, but for
so we are counting number of participants
so
here,
we are
not
only
the persons.
Looking in terms of,
for this health.
Okay, my question is my question is in relation not to the definition of participants or person per se, but the definition of the activity through which we promote the wash or the behavioral change messages. Some could be training, as you rightly say.
Yeah.
Some could be community awareness, whereby there is an open space with a large audience coming in, and sometimes it's difficult to count them. And some of these initiatives can take place even through media. It could be a radio program, for instance. So, are we focusing mostly on trainings here?
Yeah, definitely. This is on.
It could be hard to report.
No. This is definitely on the trainings, what the projects are conducting and where they are counting the participants. What you are doing through media, it cannot be. We cannot count, as you said. If it is a large audience, we will not be knowing how to reach them, how we have reached them. But
may I kindly ask you to update the description, making clear that we are referring to either training or one-on-one sensitization or events whereby it's possible to count the audience. Because even when you have, for example, a session within a community and people come in and out, it's even difficult to count them. So maybe we could try to be, or add some more specifics on the description.
Yeah, what I would request you, David, if it is okay with you, you can just send me the message what you think it is ideal to give a pop-up message, right?
Okay.
So that we'll alter it. We'll
Okay,
alter
I
the
will do
pop-up
that.
message accordingly, but it would be done only for 2016 forms because 2015 are already in, and
Yeah, it's okay.
yeah, it would be really good if you can give us a clear wordings so that we can update that one. We are fine with it.
Okay.
Okay.
Thank you. I will do that.
Yeah.
Yes.
I'm just noting down. Just give me a moment. Okay. Thank you. Next would be the training and retraining of community and health workers. Here you are counting number of persons. As we have put it here, a person can be counted in different trainings. So it is each line. Number of persons formally trained or retrained for NTD or WASH activities across all NTD. Refer to 1 to 5, which is on the top. You are putting here. And number of surgeons formally trained or retrained. I think you are more aware, means more experts than me, because I don't know much about NTD. It is, I can tell you the logically, a person can be counted in more than one line here if he is participating in other lines. For example, if a person is participating, is formally trained in MDA for Onco, he will be counted here also. And if the same person is attending or retrained in SCH, then he will be counted here in the next line also. That is the logic. Okay, then last would be the environmental changes. Here, number of accessible latrines constructed or repaired. You can just put the full number for these two lines, and this form is only to be reported by only those 13 projects related to the NTD work. And this is what is a very simple reduced NTD form, and it will be yearly. And what I would request is, please go through the forms, discuss with your program officers, and if you are facing any challenges or any questions, please write back to us. We will try to get back to you with the answers, discussing with our advisors also. And if you require, after going through this forms with your group, if you feel that one more session is required to clarify the questions you have, we can even arrange for that one, not a problem. Yeah, so that's all from my end. And what I would request is, if the regional office and the country coordination officers, if they are doing any work which is in the other form, which is especially this inclusion and empowerment part, if they are doing not through the partners, for example, if they are conducting a child safeguarding workshop, which is not for partners, because if it is for partners, then they would count the participants in their project numbers. If the say CCO or a regional office is conducting a child protection workshop for say outsiders, they can just put it the number of participants and there are persons with just an example to let you know that the regional office and the country coordination office also can report on these activities if they are working, but ensure that this is not double reported by the partners also. Yes, if there are any questions.
I think we are all shocked by looking at the work to be done in rolling out the forms. So I think we might be a bit speechless now, but I don't know. Janet?
No, okay, mine was just a comment.
Yeah.
And I was just wondering whether Venkatesh, you can give this training to the POs who missed this training. Yeah. Because of course they are more technically aware of these things. And I don't know whether Davide, you agree with me.
Yeah, I can definitely give another session, no problem. What I would request is, once this is recording is stopped, I'll just try to save it in a good manner, Whoever the POs are missing, they can just listen to this recording, and after that I can give a second session if you require, and if in a convenient time for you, that's not a problem.
Okay.
I think the suggestion from Janet is very important, and good enough. We have most of the country offices with us next week here on Monday and Tuesday, and eventually contact you before the end of the week for another session.
Okay.
Also with those that have missed today, but of course we will share all what we can. But I do support the point from Janet.
Yeah. What I would suggest also is, if they have heard for this recording session, I think they would come up with more questions if they have. That's what was my feeling. I'll just try to save this one, because we had trained all the other regions, and we found that some of the recordings what we had recorded has not come out properly. So I was just saying, at least let us try with this one what we have discussed. Let us see how it comes out. I'll just share you with the link, and you can hear it if that is okay. And I'm happy to give another session. Just tell me when you want, so that I can block that date and time.
Much for that.
Hello? Yes, David?
No, I was thanking you.
Okay.
I agree, at least on my side. I agree with your proposal, and thank you for your availability on that.
Yeah. So what would be your first reaction? How it is? The form is good, bad? What do you feel with the improvements with the yellow cell backgrounds, whether it's helpful? Just a small comments from your end.
Okay, Venkatesh, maybe I could comment.
Yeah.
I think the form is really good now, and it's not bulky. You've tried to consolidate most of the information on one sheet.
Yeah.
So that's an advantage. But the next thing is that I just think if this thing goes quarterly and we sort of have not synchronized it with the PPR, we'll be overburdening the partners with a lot of I don't know, spreadsheets to fill in, because the PPR itself is a spreadsheet, then they have to fill in this quarterly. So we just have to look at how we will manage this next year with the kind of partners.
Yeah, really, Janet, this is really a challenge for us also, because as I said in the beginning, we are planning to integrate this maximum by next year. It should be integrated. That is our aim. But until this is integrated, it will run parallelly.
Okay. Okay.
Yeah.
My side, I think it could be, well, I agree with Janet. Thanks for reducing the burden, especially the number of questions in the form. I think that was great. And I hope there will be, at least after the first quarter, a moment in which we can regroup and double check on the use of the form. We might have some practical, issues
definitely
to raise and discuss with you. Yeah. So I think that could help.
Yeah, please.
And my question to you is my question to you is this is final to possible revision after the 2016 experience.
After the 2015, maybe for 2016.
No,
Hello?
No, I meant we are using now for 2015, and then we roll it out quarterly for 2016.
Yeah.
As we are considering a possible integration with PPR, are we now looking at the final form, or you expect some changes during the course of by the end of the next year?
By next year. By next year, we are planning to integrate into PPR, and we are planning to make it into the PPR. Our plan is not to ask statistic forms if everything runs smooth. If it is fully integrated into the PPR, then we may not even require statistic forms. It will be just PPR
Okay.
for 2017.
But when you integrate in the PPR, more or less the template will reflect the one that you have now.
For 16, for the 16, it would be the same template. And as I said you in the beginning, only for quarterly things. If, for example, we'll be adding one more row in the top just to make provision for the quarter, or if there are, as you said, as you are recommending some wordings for the background information to be more clear, only those things will be changing. And I assure you that more than 95% will be the same, and we are not changing anything for 2016. It will be the same form for 2016 for quarterly.
Okay, thank you.
Yes, Janet, have any other questions?
No, Venkatesh, sorry, no.
Okay. So please discuss among your group, and if your partners are asking you any questions which cannot be solved, or if you require any support, please write to us, Skype us, or send an email. Anything, we'll try to get back to you as soon as possible with the answers. So thank you very much for joining. If there are no more questions, then I would stop. Okay, thank you very much. Have a great day. Thank you.
Thanks, Venkatesh.
Bye. Bye.
Bye.